The problems of anti Black racism in healthcare, including in public health, came to light as never before during this pandemic. Roberta Timothy is an assistant professor and now the first Black health lead at the University of Toronto's Dalalana School of Public Health. She's also the principal investigator for Black Health Matters, a research project about how the COVID-19 pandemic has impacted Black communities here in Canada and around the world. And she joins us now for more. Welcome. I think a lot of people know what if someone is bigoted or prejudiced, but I'm not sure, or if you're racist, but I don't know how many people know the definition of if you're anti-Black. So how would you define anti-Black racism?
I think anti-Black racism is a particular violence that is put on Black communities or people of African ancestry, and it is based on being of African ancestry. So it's a type of violence and exclusion that occurs based on violence. And it's really important to say when we're talking about anti-Black racism to talk about it as a violence. It is not just to be prejudiced against somebody, but it's actually to cause physical, mental, social, and financial harm. So it's a particular type of racism. There's many different types of racism, and anti-Black racism is one that is put on or acted out on people of African ancestry.
And not to refute anything that you said, but I'm sure people who are watching it or listening to this, our conversation, might hear violence and think, if someone says something, is that really violence? Because I think for a lot of people, violence is like a physical act, or if you,
Yeah.
you hurt someone in a physical way. So why should we consider it to be a violent act?
I think that's a great question. I've worked in anti-violence community for over 30 years, and it's an act of violence because when somebody says something to you that actually creates, mental health issues, or somebody looking at racial profiling or the actual act of police violence, it's actually, there's actually physical responses or physiological responses and outcomes from experiencing violence. And the reason I say it is violence, because there's a history of violence, in terms of the Black community. So if we look at the impact of colonization, the impact of anti-Black racism comes from colonization, at basically the history of enslavement of African peoples and the history of colonization in the African continent. So there's a history and a social political context that is really important to understand.
How does anti-Black racism then present itself in healthcare?
Well, unfortunately, anti-Black racism presents itself in healthcare in many ways. One, it's in terms of access to treatment. Black communities are not given the same resources. There's not the same, healthcare. We don't have a lot of Black healthcare practitioners. And also, when we go and seek treatment, we actually, unfortunately experience what I would say anti-Black racism or health violence, which means that we're not heard or we're not listened to. For example, in terms of pain medicine, there are many studies that have looked at the fact that Black folks who come and say that they're in pain or that they need medicine, that we're actually not given the same amounts of pain medicine as other communities. And that directly relates to anti-Black racism and the practice of exclusion. So that many Black people, when they have an emergency or a health issue, they actually don't come to the hospital, or they don't come to the community centers to get support until it's too late. So usually it's an emergency situation or urgent situation, which makes people then come to seek services. Myself, who's in the community, who's worked for many years, has also experienced different types of anti-Black racism when I've sought healthcare.
We are in a pandemic, and from what you're saying, if this history already exists, there seems to be a lack of trust. So during a pandemic where we are listening to people in public health, how has that showed up, this mistrust between the Black community and public health?
That's a really important question, and I think important thing to elaborate on. First of all, so before COVID-19, anti-Black racism existed in the healthcare system. So, we can also see it in chronic health. We can see it in diabetes, higher diabetes rates, lack of cancer research, HIV rates, and many other health rates or health impacts directly relating to anti-Black racism and lack of resources in our community. So when COVID-19, a pandemic, 100-year pandemic, happened in our community, we were disproportionately being impacted by the pandemic and still are in our communities. And even within the, we spoke very early on, and I'm saying Black health professionals spoke about the impact on Black communities, and we were told that race and racism, or particularly anti-Black racism, and Black communities were not a priority within the pandemic, in terms of trying to get resources. And in fact, later on, that was changed. And now we know that we're looking at how Black people are disproportionately impacted. I also want to say that the there's distrust within the community before COVID-19, which now is intensified during the pandemic. Folks, do not trust the system that they didn't trust before to protect them. So it's been a real challenge to get resources and to support the disproportionately affected or impacted Black community during this pandemic.
I want to come back to talk about the pandemic. We've been hearing a lot about, interventions that are taking place to combat some of the inequalities that we've been seeing throughout this pandemic. Yeah. What anti-racism interventions are missing from Ontario's healthcare system?
Well, that's such a good question. I think that we have to go back to the beginning. I know some folks don't want to, but we have to go back to the beginning when there was a call from Black health professionals to actually give resources. So resources, there have been some resources allocated, but still the resources in our community are quite limited. So part of interventions is having programs, right, and having monies to support community. There are some grassroots community initiatives. There are some food insecurity initiatives, but there are bigger issues in terms of housing insecurity. There's multi-generational houses in terms of the Black population. There are folks who are living in places and spaces that are not secure. There are job and employment apartheid or inequities that are happening. So it's to create interventions, we have to look at the overall system. And I think that not only a regional body needs to happen regarding this, but a national, we need to have national conversations in terms of not only the impact of anti-Black racism, but how are we moving forward to actually combat it and dismantle anti-Black racism within our healthcare system and hopefully society.
And when we talk about the Black community, we know that the Black community is not a monolith. It includes many people from very many different parts of the world. And over the past little while, we've been hearing the word intersectionality a lot. What role can intersectionality play in healthcare?
Intersectionality is something that is such a beautiful word, term, framework to use. I think that it's been, if we look at intersectionality, it's really actually not quite new, but I think it's new for maybe for mainstream in different ways. Intersectionality challenges the notion of homogeneousness in the Black community. One impact of anti-Black racism is the notion that all Black people are the same, that we all experience the same and have the same needs in healthcare and wellness. And what intersectionality, particularly in health, what it does is it allows us to look at the heterogeneousness of Africanness and Blackness. So what that means is that we can look at, the different regional experiences that we have as African people or people of Black ancestry. We are coming from different classes. We come from different gender identities. We have different disabilities, accessibility needs. We have different migration experiences, different languages. And it really, I try to think of it as a kind of a beautiful stew. Not a melting pot, but a beautiful stew of different African and Blackness, and looking at the different experiences and different wellness systems that we can actually utilize to support Black communities locally and globally.
And within those communities too, we have the elders and we have children. How do you see the intersection of Black elders and children affecting health outcomes or public health in general?
Elders are so important to our communities as African peoples, and it is really critical because our elders within the Canadian context are experiencing isolation. They're also experiencing, services that don't necessarily support their cultural beauty or their cultural differences and what their needs are. So our elders are really needing to be supported in the Canadian context. Also, in terms of our children, we know that African Black children are not only being taken away in terms of Children's Aid Society and being surveilled, but also in terms of child development. That children are our future, and it's critical to have programs and interventions to support them. When we think about the impact, the mental health impact of COVID-19 right now, and the impact of anti-Black racism, particularly in our communities, it is really critical to have a lifespan notion. So look over the lifespan of elders, of children, of adults, of maternal health. We have a lot of maternal health morbidity in our communities, but really looking at how we can create wellness for all of our community members, from the youngest to the oldest. And I think it's a critical practice that we really want to initiate and support within all interventions in the Black community.
We talked about COVID and the impact on the Black community, and how it's disproportionately impacted Black and racialized communities. What lessons do you hope we learn from the pandemic moving forward?
I think one of the major lessons to learn is the importance of really creating safety and trust within the Black community and other racialized communities, or also what I call purposefully marginalized communities, creating a trust and a discourse, so that when another pandemic, and there might be another one at some point, comes, that we actually have resources, we actually have communication, we actually have addressed the health inequities within the system, so that we're actually all starting from a place of trying to actually deal with the pandemic, but not actually having to deal with the anti-Black racism and other types of health violence aspects within a pandemic or within a situation. So I think the learning is that we need to actually create inclusive policy and processes in our healthcare system, and to try to have conversations and resources, and to deal with the historical and current day problems within our system, because we know that they intensify during a crisis, which we see today. We also need more Black leadership. We need more folks who have decision-making powers in our healthcare system. We need to have more Black doctors, Black teachers. We have to create a consciousness that actually includes Black health and wellness and prioritizes it within our healthcare system.
As I mentioned, you were the first Black health lead at the University of Toronto's Dalla Lana School of Public Health. What are some of your goals in this position?
I'm excited to be in this position, and I'm also very honored to be in this position. Some of my major roles there are three. One is mentoring Black students, upcoming public health practitioners, and I have a mentoring group which I'm really lucky. I learn a lot from the students. The second is a lecture series on Black health, which we hopefully will be launching very soon, and having lectures on various Black health issues. And the third, the kind of in some ways the most exciting or innovative, even though all of the other ones are quite good, is the creation of a Master's in Public Health program in the field of Black health. And right now we've sent a proposal. We're looking to see if it can pass through University of Toronto, and we are hoping to start in September 2023, which would be the first Black health program and Masters of Public Health in North America.
It's 2022, and we keep hearing of the firsts throughout different industries. What does it mean for you personally to be the first in this position, and to be that leader that you were talking about, and be at those tables?
I feel honored, and I feel humbled, because I think about our ancestors. I think about our people who came before us, who led the way, whose names we don't know, most of them. We do know some, who've led the way to give me this opportunity to be able to do this work. I feel like there should be more me's than just one. I hope that this the Black Health Lead and the MPH program, I hope that we can see many more locally and globally. It's really an honor to do the work, but it's also comes from such a history of struggle, right? And I'm very grounded in that struggle, and knowing that this is a continuation, not a beginning, but a continuation of a struggle for emancipatory and empowerment-centered practice for Black communities, and that I really, there's going to be limitations, there are going to be mistakes, but I'm grounded in trying to continue the legacy of creating Black wellness and Black healing for our community. So I'm very honored to be in this position.
And this will be out for the 2023, right?
Yes, that's what we're hoping. We need to, wait for the approval. There's always approval processes, but we're hoping and we're hearing good feedback that it will happen. So September 2023 will be the launch of this new program, hopefully, and we hope that other public health programs and health centers will continue to do resisting anti-Black racism work and promoting Black wellness and healing.
Well, congratulations. Thank you so much for spending
Mhm.
some time with us and talking to us about some of the issues that are happening within public health for the Black community. We really do appreciate your insights and your time. Thank you.
Thank you so much. It was my pleasure meeting you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.